We have to validate the person's feelings. If they're saying that that's how they feel, then we got to work on it.
Because they feel like nobody's going to listen to me. They're going to be saying, but it's your parent at the end of the day, but it's our father.
There are many occasions where someone will say, my mother curses me. You know, every time I go visit her, my mother curses me. She says some really awful things to me.
When I had postpartum depression, I was put on medication.
Your long-term medication is therapy.
Like, you have to try it.
So, and they get stuck on the fix, like you said. So I think it's very important that that was addressed and talked about. And, you know, just talking about ways, and like you said, some empathy is very, very important. And knowing that we can be more supportive of our community and really, really trying to hopefully address this. And another thing to ask about that is then thinking about faith leaders. I know this is Dr. Mahmoud, you might want to add on to the suicide aspect, but if you're thinking about that, think about faith leaders. How can they also be supportive? Because people look to them as leaders and as someone that kind of is a role model to their community. So we hear from them, how can they also be supportive in helping to address these different issues that are prevalent in our community?
You know, this is not something that only a mental health professional needs to address, or only the family needs to address. It needs to be addressed at every level of the community. And that's why that's kind of the shift where a lot of research is going. I mean, you're familiar with public health research, and we do, there's that community participatory research where you're kind of bringing in, or global mental health, right? We're bringing in like all these different levels of the community, because it's not just one aspect. It's not just that the parents need to know, or just that the person who's experiencing suicidal thinking needs to know. Everybody needs to know. And so how do we make sure that the imams and the religious leaders and the kind of community leaders are aware of what all the different rulings are? There is research being done as we speak, as part of a master's thesis by Dr. Khalil Zamzami, where it is focused on suicide within looking at all the different rulings around suicide, and trying to, and what he's trying to do is kind of look at both the mental health side and the Islamic side, and through that developing an understanding and also interventions, and helping the religious leaders have a sense of that. Because as Dr. Atta said, it is not in any way, shape, or form black and white. When I was a trainee at a veterans hospital, the very first thing that when we were doing the suicide training, the very first thing that our trainers said, that no healthy person commits suicide. And this is a non-Muslim organization working with veterans, because they have some of the highest levels of suicide. And even among new mothers, it's it's like the number one or number two reason that a new mother might, how a new mother might die, either through complications of pregnancy and birth, or because she doesn't feel like she's good enough, and she completes suicide. So this is not a thing that a healthy person does. They choose it because, you know what, I just don't feel like I need to live anymore. Peace out. It's never that simple. And so I was trained, many of us are trained within the clinical world, like, oh, let's do the safety planning, let's come up with a list. Yes, of course, right? We come up with a safety list, like, if you feel like you're actively suicidal, we ask the question very explicitly, do you want to kill yourself? Do you want to harm yourself? And then we create this plan. Okay, which hospital is closest to you? Or are you going to call 911? In New York, we have comprehensive psychiatric emergency programs that are specifically for people who are actively suicidal. But, and we come up with, a list of like friends or family members who might be available to support the person in the moment. But I was trained to also, in addition to that, really be in the moment with someone and sit on the edge with them, right? Imagine like sitting on someone standing on the edge of a cliff, or the edge of a bridge, or my supervisor talked about a woman just wanting to walk into the water and just not coming out. And so what we did in the work that I do is I sit on the edge with them. Like, tell me what's coming up for you. Tell me the emotions. Like Salma said, right? Empathy, attunement, and seeing in the moment what it is that's coming up for you. What is the need that hasn't been met? And so once we do that, and of course it's like the most intense experience ever because you're in the moment and you're with them and you're feeling what they're feeling and you're experiencing what they're feeling. And then you are able to say, okay, what can I do to make sure that this person feels seen and heard? And then most times, they don't pursue suicide. They're able to see like, okay, I may not be hopeful in this moment, but this person right here is hopeful for me. She's carrying the hope for me. And okay, at least I can promise her that I'll come back next week or the next day or whenever the next appointment is. And we're able to kind of work through it. And that's, it's a very powerful thing to feel seen and heard. And, the way that I often help people understand this is if you've watched the movie Moana, and, I don't want to ruin the ending of the movie, but like in the very end where Moana figures out who Teka is, and she sees this really scary creature kind of running towards her, that she's able to figure out what's going on. And I say that's what attunement is. And that's what seeing someone is when they're raging and they're overwhelmed and they're, sick of life and they just don't want to deal with anything, that someone's able to see beyond. It's not just, this isn't you, this isn't who you are. There's something beyond this. And I think that's what is so powerful for people who are struggling, and they kind of go, okay, fine, for your sake, I'm coming back next week. And I'm like, okay, good. Don't do it for my sake, but if that's what makes it work for now, khalas, let's make that work for now. So that's generally how I approach working with people that are quite suicidal.
Allah subhanahu wa ta'ala teaches us through the Quran that these feelings of anxiety and depression, they are a normal part of life. And even Allah subhanahu wa ta'ala, says to the Prophet sallallahu alaihi wasallam, وَلَقَدْ نَعْلَمُ أَنَّهُ يَضِيقُ صَدْرُكَ بِمَا يَقُولُونَ, that فَلَعَلَّكَ بَاخِعٌ نَفْسَكَ عَلَى أَثَارِهِمْ. It used to bother the Prophet sallallahu alaihi wasallam so much that people wouldn't become Muslim, that Allah says, like, your chest is like tightening. Like it's like, are you going to you're really gonna harm yourself if you're like obsessing over this too much. Like Allah subhanahu wa ta'ala will take care of it. You just do your job, is what he's telling him. But we have so many stories throughout the seerah and throughout the prophets, such as the mother of Musa and Yaqub and Maryam and all these people who struggled with their own phases of life. But one thing that they never lost was hope. And I think that's what we have to instill to our patients, to our clients, to our community leaders, is that door of hope to Allah subhanahu wa ta'ala is always there. A lot of people, unfortunately, especially a lot of children, they have this image of Allah subhanahu wa ta'ala as that he's a cop just waiting for you to make a mistake, like a cop waiting with a scanner to pull you over for speeding. And Allah subhanahu wa ta'ala is not waiting for you to make a sin. Allah subhanahu wa ta'ala is waiting for you to return to him. Allah subhanahu wa ta'ala is waiting to forgive you. وَاللَّهُ يُرِيدُ أَن يَتُوبَ عَلَيْكُمْ. So we need to understand that, pain and suffering and grief, these are aspects of life, and we need to have these open, honest dialogues where we let the people know to come to us, to help you out, and it doesn't make you any less of a person. And that it's okay actually to complain. That's another thing I hear a lot, is that you're allowed to complain, and you're allowed to complain to Allah subhanahu wa ta'ala as well, as Yaqub alayhi salam did when he said, إِنَّمَا أَشْكُو بَثِّي وَحُزْنِي إِلَى اللَّهِ. His sons at the time, they said, you're still not over Yusuf. And actually it's funny because he was in another room when he was complaining. So he literally was only complaining to Allah subhanahu wa ta'ala. You can complain to Allah as much as you want. He's always open, he's always there for you. And I always tell my patients, you can complain to me anytime as well. That's what I'm here for. That's what we're here for. So, we'd love to help out, inshallah.
I think anybody who went to therapy can relate to like just making that step and starting to research and then making that first call and like just trying to, get everything out and figuring out, like for me, it was, for example, such a like life-changing moment when I got the diagnosis of ADHD. I was like, oh, now I get it. Like, oh my God, I didn't have to be so hard on myself on all those issues. And just like, it made it so much easier to just like having something that I even from there on I could work with. So I think that's kind of like also our goal is for me as somebody who went through that, and whenever I'm talking to friends, I'm just like, you have to try it. Like even if you think you're not struggling with it, like, no, I think I'm good. I'm like, but every time you talk about this, like it affects you still. So the question of abusive parents and bir al-walidain. It's not that black and white, but I think there are a lot of people who are watching this and who could relate. Maybe we can share something for them.
Yes, I was nodding because this is one of the most common topics that comes up in our office in particular. And this topic requires a lot of consultation with a religious consultant, and because it's a very complicated topic. It's not just we're what I'm able to do within the scope of a psychologist is address the distress and address how we might be able to help this person managing the situation. But then, the question always comes up around, well, what about bir al-walidain? What about, I need to, show this filial piety towards my parents. I need to do this. So then we have to, each person's case is unique. Each person's case has to be considered based on what the facts are. So when someone, a lot of the rulings are for, situations where you have, parents that are good parents, children that are good children. We all make mistakes. We all have our struggles, certainly. But there are exceptions that need to be considered. And, this is where we, strongly urge the, consulting with a trusted religious figure. We have, I have examples, but I also want to be mindful of my patient's privacy. But there are many occasions where someone will say, my mother curses me. Every time I go visit her, my mother curses me. She says some really awful things to me. I just don't want to see her. I don't want to visit her. What do I do? And we, the thing is, like, we can't say, no, don't visit your mother. Like, no, that's not okay for them. So in that case, we consulted, and the idea was like, well, what is it that you might do by not visiting your mother? What might that prevent her from doing? Well, it's going to prevent her from cursing you. And in that, you're also protecting her from sin. So by helping the person say, well, if you decide to take a break from visiting your mother or your parents, and you're doing it for this intention, then it's actually, you're doing a good for them rather than harming, a harm. And you are still serving them through that. But again, this is a very unique, specific situation. And I'm guessing that there are many similar situations out there. But, one of my supervisees recently brought up a case, and I said, listen, I can't tell you how to approach this case with respect to the Islamic rulings. You have to consult with a religious consultant around how to address it with the patient. But there are things that can be done to help manage that, because the intense guilt that patients feel and the intense wish to please their parents despite being mistreated is quite palpable. It's very intense. But what we need to do is also say, okay, what does Islam really say? Does it say that even if someone's hitting you, you still, you sit there and wait for them to finish? No, of course not. Of course not. So we have to be mindful of, what are the protections that children have, when parents are abusive. And there's quite a, there's protection on both ends. And, and so my thing is talk to a religious leader, a religious consultant who is trustworthy. And if you are a patient at Khalil Center, your therapist will be your advocate and help with that process as well. And that's what I do with my patients. Like, if you don't want to talk to the religious consultant, fine, I will do it for you. But let's figure this out so you can move through this experience without continuing to harm yourself or others.
What I had one patient, actually, the father of a patient who's actually a physician, who said, what is this? What is this ADHD? If it's my kid, I would have just kicked them and been like, focus or whatever, and that was it. And it's like there is that cultural divide, and there's that intergenerational divide, and that it comes down to a lot of difficult and tough conversations, and a lot of it is subjective, and a lot of it is, what's abusive to you emotionally might not be for someone else, and vice versa. but we have to validate the person's feelings. If they're saying that that's how they feel, then we got to work on it. I think that when someone says, I want to be good to my parents, I think it speaks volumes of their character. And I always tell them, inshallah, that's a sign of good faith. وَلَا نُزَكِّي عَلَى اللَّهِ أَحَدًا. We it's good that you feel that way, but it has to go. This is part of that holistic approach that we talked about, is having an imam involved, or having a religious advisor involved, and having a therapist involved as well, or a psychologist involved, and working from there.
Kind of the one thing that is used a lot against kids is like always the religious aspect, and that's kind of where it gets scary, and where a lot of children would turn away, not from the abuse itself, but also from religion. And that's very sad. Like, if that's how it's going to be treated, because they feel like nobody's going to listen to me, they're going to be saying, but it's your parent at the end of the day, but it's our father. But it's like, and a lot of manipulation is being done by like with using the book, right? And that's I think yeah, it is a topic for itself. It is a topic for itself.
So we're speaking about marriage, speaking about children, and speaking about walis, and I know there's something that come up for me. You know, Dr. Mahmoudi, you also work with like loss, right? And like I think this affects a lot of women. Like, when they get married, they're like, oh, hey, we're gonna have kids. Like, one of the first questions people ask you right after on your wedding night, they ask you that, right? Yeah. And it can really cause a lot of depression, a lot of mental health, and a lot of stigma, because if you don't have kids right away, people start questioning what's wrong with you. Why don't you have children? And that's something that's been asked to me, during my marriage. I'm sure it happened to a lot of different people. And, when I experienced loss of my first child, it was a very, very dark time for me. I didn't know where to go for support. And I think a lot of women like kind of face this. They don't know where to go for support. They don't know what to do. And there's a stigma around that. Like, you don't want to talk about it too much either, because then people are like, well, is something wrong with you? Like, why are you losing, this and that? So, from your experience and background, like, what, do we say, to women who are going through this, and those who are experiencing infertility, issues, and, just kind of like not seeing light at the end of the tunnel, or maybe they can't have children at all, and they really are really dealing with a lot of depression, and even postpartum depression. Like, when I had my daughter, alhamdulillah, I was excited about that. Within the first year, I had severe postpartum depression. Mm-hmm. And again, these are some things, I'm going to talk about.
This area is my passion. My research focuses on this. My postdoc work, 2 years I worked at a maternal mental health clinic, and I see a lot of women within the perinatal time frame, and work a lot with loss, perinatal loss in particular. And I think the first thing that people have to understand is that we all have a reproductive story. And sometimes it can start when we're a small child, right? If you see your daughter playing with dolls, right, we can kind of see what they do with that. Do they imagine themselves being the mommy, and then there's a daddy and there's a little kid, right? So, and then some people don't think about children until many years later. Some people think about it in college, some people think about it as soon as they get married, right? So people think about the idea of being a parent at various stages in their lives. So imagine someone who is just, they're a little kid and they're imagining themselves to be a mommy, and I'm going to be such a great mommy. And then, they get married, and it's time they can actually start thinking about building a family, and they're struggling. They're not able to. So this can be a devastating loss, because there is this expectation that when I am ready to get married, that means I will also have this opportunity to have a child. And so when it doesn't happen the way someone might expect, right, the reproductive story, I often would tell my patients, now we got to edit the story, right? The story has already been written. There's a conclusion, there's an ending. A lot of my fertility patients would come in with these massive notebooks and like, okay, child 1, this time, child 2, this time, child 3, this time. And I'm like, ooh, okay, everything's already been written, which means now we gotta get the eraser and edit, or we gotta push the delete button and edit, because that's not exactly what the story is gonna look like. And so there's a lot of compassion and a lot of caring that's provided within the therapeutic scope, but the problem is that the society at large has not caught up with the needs of the perinatal woman. right? Whether it's, and fathers too, I'm not going to exclude them. I know that, men have, imagined themselves being fathers. They imagine themselves, and if there is a delay, that will bring up a lot of concerns. But you asked a lot of different questions, right? We're talking, the kind of the talking within loss, talking within postpartum depression, talking within fertility. All of these are very different experiences. But what is unique about this time frame is that we don't talk about it, and we're not allowed, right, in quotations, to talk about it, because you have to be grateful as a Muslim. You have to show happiness that Allah is, if, for example, you have a healthy baby, be happy that you have this healthy child. Yes, and what about these emotions that are coming up that are completely outside of your control? That it's not that postpartum reactivity that women will experience when the hormones come down from like the really, really high estrogen, progesterone to baseline. Those emotions are normal those first 2 weeks after giving birth, right? There's some highs and there's some lows, but once a woman is out of that time frame, and she's still feeling down, people say, what's going on? Why are you sad? Why are you upset? And there's this expectation, right? There's that word again, that you're bonding immediately with the baby, that that you love breastfeeding. It's the funnest thing in the world. Holy moly, no way. What are you talking about? This is not the case for every single person, right? So we have to be mindful of that. And especially when someone experiences a loss, right? It's okay. You're going to have another one. It's okay. Move on. No, it's not okay. Let's spend some time mourning the loss of this fetus or this baby, however someone might conceptualize it, and the loss of expectation, right? You started to think and imagine in your mind that I'm going to have a baby and the baby's going to be so cute, and now that expectation has been lost. And so what we do in the therapeutic world is we acknowledge the loss. Like, yeah, you experienced something really challenging. And now I'm going to help you move through this experience, because when you are ready to have another child, or if not, that's a choice, right? But if you want to have a subsequent child, that it is going to be a separate experience than, than connecting it with that first experience.
What are the perspectives that you would want to share, like as a professional, about medication?
When I had postpartum depression, I was put on medication and I had severe side effects as well. So kind of addressing that too, and like how we can navigate through that as well. I wanted to add on to that.
Sure. Well, one thing that I always preface medications with to all my patients is, these medications are not going to fix your marital problems. They're not going to make your boss any nicer. They're not going to fix your financial problems or make your kids any less stressful or easy to deal with. But what they'll do is they'll give you some motivation, concentration, attention. They'll affect your neurotransmitters so that you can work on those things. And I tell this to almost every single patient, literally. I tell them your long-term medication is therapy. I almost always tell them that, because sometimes people tell me, I don't want to be on medication. I tell them, that's fine, but I want you to be in therapy at least. I want you to be following up with someone. To your question though about addictions, yes, there are some medications that are addictive. I'm personally very conservative when it comes to medications. I believe that less is more. I try to stay away from the potentially addictive medications. But if it's something that I feel they need, then I help them balance the pros versus cons. I try to tell them, okay, what's life like without the medications? And here's what life might look like if you follow all these other steps. And, when they say things like, well, I don't want to become dependent, or I actually once saw a Facebook status about someone on a stimulant, and they said, I feel bad that this medication dictates how I feel, or dictates my ability to move forward, something along those lines. And I told that person, you are the one in charge. You are the one in control. This medication does not control you. You're the one who's still going to make your decisions. You're the one who's still going to be responsible and accountable for the choices that you make. So this is what's going to help you move forward. And I'll go another extreme, and I'll tell you about a a patient or patients, I should say, who are abusive towards their spouses, and they'll say, "Will this medication make me stop hitting my spouse?" And I said, "No, there's no medication for that sort of thing. That's your choice, and that's on you." So that's another thing. I always tell people medications are just one part of the holistic approach that includes diet, includes exercise, includes going to therapy, it includes practicing your religion appropriately, and it includes holding yourself accountable and not relying on medications. Because dependence, yes, there is physiological dependence, but there's also, I believe, psychological dependence that I need this or I can't move on. That's a whole other realm.
Can you tell us more about Khalil Center and what you offer and how you are supporting the Muslim community?
Every one of the Khalil Center offices has a particular model where we have the mental health professionals and we have the scholars. And so all of our offices have the mental health professionals and we have a religious consultant. So here in the United States, we all live in the United States. So here in New York, we we have a team of 3 clinicians, and we have Sheikh Murabit Benavides, who's our religious consultant. And patients will bring up issues around jinn or jealousy, sihr, magic, or the evil eye. So they bring in these different topics. And as a mental health professional, I can't definitively say no, that's not jinn. Like don't worry about it. This is just depression. So that's outside the scope of my knowledge. And also, the patient is going to be like, well, what do you know about Islam? Like, you haven't studied extensively. And so this is where we would either connect them with the religious consultant, or I consult with I'm smiling because my husband is our religious consultant, and so we consult over cases all of the time, and we're talking about some of the issues that people bring up around I'm feeling really down. I felt down for a really long time. I don't think this is depression. I think it's the jinn. So okay, well, I think it'd be helpful for you to talk to the religious consultant. They'll say, I don't really feel comfortable doing that. But okay, let me do it. Let me check in and see. And so we'll have a conversation, and I come back to the patient and say, well, based on the things you're saying, it doesn't appear that this is a jinn issue. It sounds like it's more of a mental health issue. So how would you like to proceed? So we definitely will bring in religious coping to help the depression, but we also make sure that if someone, for example, their symptoms are severe enough, we might refer them to a psychiatrist or an NP, or we might refer them for other type, group therapy if it's something that would be helpful to them, or continuing with individual psychotherapy. So I think the model that Khalil Center has developed is trying to address the needs of the Muslims, both respecting the spiritual and making sure that people feel spiritually fulfilled, while also addressing the mental health concerns, and then providing education to the community and providers at large.